Hi, I'm Dr. Dhanvanti, and you are watching Anatomy of Bias.
So I think one of the biggest concerns, and because breast is treated as a sexual organ, we tend to see this societal bias or issues related to it very often. I think one of the cases that stayed with me over the years was not just the fact that she came in late because of a concern about not wanting to be examined, was how her family treated her during treatment. And we realized this much later when she started not coming back in for investigations or for treatment, was because her family ostracized her. And this was something as simple as them considering cancer to be something that was contagious, because of which her utensils were separate, her entire household was moved into a separate corner. And when she tried to come in for treatment and tried to deal with that, they actually asked her to leave the house. She stood up in one of our support group meetings and talked about it. And of course, the NGOs did get involved. She got a lot of help after that. But I think it was really difficult for us to understand how she could be taken away from a family that she had always been there for. And for them, it was as simple as you have cancer, you're a liability, it can possibly come to us, so we would rather not be part of this. And you start realizing that that's how women don't come in for treatment early. And something as simple as that she wouldn't come back in time for investigations. She took a really long time after the first sort of the first meeting, to come back and see us again with repeat investigations. I think a lot of it turned into a societal concern where no one wanted to talk about it. Her relatives wouldn't come home because of that. Her neighbors treated her like, it was something they would get into their house. She must have done something wrong to get breast cancer.
Dr. Nair, can I ask you how old was this lady and what was her position in the family?
She was actually the 41-year-old mother of the grandchild, wife of the husband or the son, and the woman running the home. She was actually a house help for somebody else's house. So she ran that house with her money, but it became an issue because suddenly now she needed help and no one
So,
was going to
despite being
stand
the
with her.
primary caregiver, being a breadwinner, she was still not given the respect and care that she deserved in a situation where what she really needed was compassion. How
Absolutely.
common is this? How often do you see this?
Unfortunately, they aren't uncommon, but they aren't far and few, but they are there. I will say that this isn't a particular concern of only the lower strata. This is just something about being empathetic and being respectful of women or not, and giving them their identity in society.
So, tell me, Dr. Nair, what happened to this lady who was discarded from her family and treated well?
So, fortunately for her and for us, our NGOs were able to take her over. She did eventually start a joined one of the NGOs and started some of their vocational work. She was part of that. She was taken into one of those homes for them. But unfortunately, her family never took her back. So it was a choice she had to make about choosing to get treatment versus being with her family. And fortunately for us and for herself, she chose herself and chose treatment.